What is gastroenteritis? Gastroenteritis is an inflammation of the lining of the intestines caused by a virus, bacteria or parasites resulting in leakage of fluid from the cell into the intestine, diarrhea, abdominal pain and vomiting. What are the causes of gastroenteritis? Viral gastroenteritis. The most common cause of gastroenteritis is viral. Rotavirus is the leading cause among children 3 to 15 months old, and the most common cause of diarrhea in children under the age of 5 years. Adenovirus occurs mainly in children under the age of 2 years. Caliciviruses, especially the norovirus, cause infection in people of all ages. Astrovirus also infects primarily infants, young children, and the elderly. Bacterial gastroenteritis. The most common cause is the E. coli bacteria, usually mild with diarrhea, abdominal pain and occasional vomiting. It rarely causes fever. Salmonella, Shigella, Vibrio cholerae are more serious bacterial infection causing diarrhea and high fever. Parasitic gastroenteritis. Most common is amoebic dysentery, common in India and Africa. Other parasitic infection are giardiasis and threadworms. What are symptoms of gastroenteritis? The main symptoms of gastroenteritis are 1. Watery diarrhea. 2. Abdominal pain. 3. Vomiting. 4. Headache. 5. Fever. 6. Loss of appetite and energy. Symptoms usually appear within 4 to 48 hours after exposure to the germ and last for 1 to 2 days. Those symptoms can last as long as 10 days. How is gastroenteritis transmitted? Gastroenteritis can be highly contagious. The germs are commonly transmitted by people with unwashed hands. People can get the germs through close contact with infected individuals by sharing their food, drink, or eating utensils, or by eating food or drinking beverages that are contaminated with the germs. Noroviruses in particular are typically spread to other people by contact with stool or vomit of infected people, and through contaminated water or food, especially oysters, prawns, crabs, lobsters, cockleshells from contaminated breeding waters. How is the diagnosis of gastroenteritis made? Doctors generally diagnose gastroenteritis based on the symptoms and a physical examination. Your doctor may ask for a stool sample to test for rotavirus or to rule out bacteria or parasites as the cause of your symptoms. How is gastroenteritis treated? Most cases of viral gastroenteritis resolve without specific treatment. Antibiotics are not effective against viral infections. The primary goal of treatment is to reduce the symptoms, which may include an antispasmodic drug to stop abdominal cramps, medicine to harden the stools such as kaolin and slow down the intestinal movement, Lomotil or loperamide. Prompt treatment may be needed to prevent dehydration, which is the loss of fluids from the body. Important salts or minerals, known as electrolytes, can also be lost with the fluids. Dehydration can be caused by diarrhea, vomiting, excessive urination, excessive sweating, or by not drinking enough fluids because of nausea, difficulty swallowing, or loss of appetite. The symptoms of dehydration are excessive thirst, dry mouth, little or no urine or dark yellow urine, sunken eyes, severe weakness or lethargy, dizziness or lightheadedness. Mild dehydration can be treated by drinking liquids. Severe dehydration may require intravenous fluids and hospitalization. Untreated severe dehydration can be life-threatening, especially in babies, young children, and the elderly. The following steps may help relieve the symptoms of gastroenteritis. 1. Allow your gastrointestinal tract to settle by not eating for a few hours. 2. Sip small amounts of clear liquids or suck on ice chips if vomiting is still a problem. 3. Give infants and children oral rehydration solutions to replace fluids and lost electrolytes. 4. Gradually reintroduce food, starting with bland, easy-to-digest food, like porridge or soups. 5. Avoid dairy products, caffeine, and alcohol until recovery is complete. 6. Get plenty of rest. How is gastroenteritis prevented? You can avoid infection by 1. Washing your hands thoroughly for 20 seconds after using the bathroom or changing diapers. 2. Washing your hands thoroughly for 20 seconds before eating. 3. Disinfecting contaminated surfaces such as countertops and baby changing stations. 4. Avoid eating or drinking foods or liquids that might be contaminated. And this is all about this ailment. We will return with more curious, interesting, and useful topics in Find Out How. Share our content if you think it may be useful to other people. Follow us on social networks. Be happy.